Good morning, everybody. The topic of my presentation is the guided superficial enhanced fluid fat injection procedure for facial rejuvenation, an Italian multicenter retrospective case reports. When we talk about autologous regenerative therapy in aesthetic medicine, we are talking about autologous homologous microfragmented adipose tissue graft, and it leverages the power of the stromal vascular fraction and mesenchymal adipose-derived stem cells, growth factor, and exosome to restore the volume and regenerate the skin. I wish to share with you my story. Over the past 15 years, I've been focusing my interest on this topic and some question and reason in my mind. First of all, why would we harvest the tissue using a liposuction cannula with large side port sole, only to then require its manipulation with devices to make the tissue more fluid for injection? And so in 2015, I published my technique, the Seffiller technique, superficial enhanced fluid fat injection, that involves the use of a micro cannula with a micro side port sole in order to select the right dimension of a tissue cluster, and so the tissue doesn't need any kind of manipulation to be injected. And after that, in 2021, we published our study, and we proved that the device that doesn't involve any kind of manipulation of tissue yields the higher amount of cell viability and stemness. Another important question: why we would centrifuge the collected tissue to concentrate the adipocyte when we know that for regenerative therapy the most crucial cells are the stromal vascular fraction cells, and then running the risk of losing these vital cells in the washing liquid? And many studies proved that the decantation and the low vacuum pressure yield the highest cell viability. And again, why should art be performed exclusively by doctors with surgical skills? And so in 2021, we published another interesting working about the guided Seffiller, where we present a special patented guide, and it doesn't require a surgical skill and allow to harvest the adipose tissue in a standardized, simple, effective, and safe way, also by a medical doctor. This cannula prevents any risk to insert the cannula too deeply, because the tip of the cannula come out from the blade of the guide only 15 millimeters, and it's far away from the guide only 15 millimeters. Then also a doctor without any surgical skill cannot introduce the cannula deeper than 15 millimeters and standardize harvesting tissue only in 15 millimeters of depth. And again, many studies prove that the tissue harvested in the superficial layer, the set, is richer in stromal vascular fraction, adipose-derived stem cells, growth factor, and exosome. So at the end of this story, we standardized the guided Seffiller technique designed for performing aesthetic autologous regenerative therapy by medical doctors in a medical facility in a very simple, safe, effective, and standardized way. But another question kept lingering in my mind. Are we really sure that this procedure, when performed in a medical facility by aesthetic physician, is truly safe? And for this reason, we, from the 2019 to 2021, we involved 10 Italian medical centers and to study the safety of the guided Seffiller as a single procedure in 63% of the cases, and in the 37% of the case combined with other medical procedures. And we published our study last year, and this study is a retrospective analysis of the data obtained from 2,365 healthy patients. And we found that the complication in the donor side is almost only the ecchymosis, apart 1.3% of hematoma. And in the donor site, the complications are almost only ecchymosis. And comparing our study with another studies published in 2022 of facial fat grafting that involved 5,479 patients. And we can see that all the complications, severe, moderate, or minor, in the guided Cepheid procedure is lower than the other procedure. And so we can say that yes, the guided Cepheid procedure is a safe procedure. Here you can see some cases. This patient is after almost 5 months after the procedure. You can see the enhancement in the quality of the skin and the tone, but also with the Vectra system, we can analyze the volume restoration. You can see that after 5 months, you have a volume restoration. And you can see here, after 4 months, it's a dramatic improvement in the quality of the skin and the tone of the skin. Also in younger patients, after 6 months, you can evaluate appreciate the enhancement in the quality and the tone in the male too. And now I'm showing you some cases from doctors involved in the study. For example, Dr. Piccolo, you can see the dramatic improvement of this lady after 4 years of regenerative therapy. Again, this is a great case from Dr. Rosalba Russo, the combined Cepheid and threads. And here, Dr. Melfa combined the guided Cepheid and hydroxyapatite of calcium. And again, this is Monica Baldesin, guided Cepheid combined with Endolift. In conclusion, we did the end of the story. Now we have a system with a guided system that allows doctors without any surgical skill to perform the procedure in very safe and standardized way. Using this system and this device. Also, this device is disposable all in one. The procedure is possible to perform in a medical facility and takes no more than 35 minutes. And the study that I presented to you involved 2,365 patients, proved that the guided Cepheid is one of the safest autologous regenerative therapy technique. And so I think that starting a new path is scary, but at every new step we realize how dangerous it wouldn't be to remain still. Thank you for your attention.